Welcome to True Health Tuesdays, and the truth will set you free. Okay, we're not broadcasting live right now, so this will be recorded because we've got a problem with the internet. We're going to talk about the difference of what chiropractic and allopathic is, or what is going on with society. But there's a lot of people that are criticizing, and has anyone in here ever done something, like anything? Like maybe cooked dinner or driven anywhere? Okay, if you're going to do something, you're going to make a mistake. There's going to be some challenges. And do you think there's a lot of critics out there that's going to point the finger? Like, why did you do that? Okay, Teddy Roosevelt. Anybody ever hear of him? Okay, one of the stories I like about him, not just the Rough Riders and everything else, but he had a cigar case in his chest pocket covering his heart. He was assassinated. The bullet went through this into his chest wall, and he finished an hour-long speech. So this is a guy you don't want to screw with, okay? And so he was pissed off with these spineless bastards that have no balls to do their own work, and they're criticizing. Oh, I'm sorry, is my opinion showing? Okay, just listen to this, because this is going to give you heart and soul. I mean, just amazing. It's called The Man in the Arena. It's not the critic who counts, not the man who points out how the strong man stumbles or where the doer of deeds could have done better. The credit belongs to the man who is actually in the arena, whose face is marred by dust, sweat, and blood, who strives valiantly, who errs, who comes short again and again, because there is no effort without error and shortcoming. But who does actually strive to do the deeds, who knows great enthusiasms, the great devotions, who spends himself in a worthy cause, who at best knows in the end triumph of high achievement, and who at the worst, if he fails, at least he fails while daring greatly, so his place shall never be with those cold and timid souls who know neither victory nor defeat. God, I like that. You know? I mean, Teddy rocks. And the reason I bring this up is because we've got a problem. I mean, I'm going to explain what chiropractic is, okay, what it's not. But the challenge is the mindset of America. I mean, this is literally the stats for America. Now, why? Why are we the sickest species on the planet? Because if you have the idea that you're genetically predisposed to illness, that you're born weak, okay, you're born just sick and defective, then if that is your paradigm, is that how you look at healthcare, then it makes absolutely no sense to look at any type of research on nutrition or health, because you're genetically defective. You're predisposed to get this. There's nothing you can do. And in fact, the best idea that if you know you're going to get some of this stuff, because you're talking 1 in 2 cancer, 1 in 5 with an autoimmune disorder, you're completely defective, so you're a victim. So if you think this, your family's going to think this, your community is going to think this, so you're just a bunch of victims. And there's nothing you can do about it. Thank God for the medical system, because they're going to give you a drug to keep you comfortable while you're going to get the disease, because there's nothing you can do. Now that is the mindset out there. Can you see this? Okay, so now what is this doing? So why are we so sick? You're right, we do need more drugs. Okay, Ashley, call the drug development, see if we can get more drugs. Do we need more drugs? Do you need more access to drugs? Okay, driving the 1.5 miles from my house, I pass 5 pharmacies. Okay, so we don't need more access. Do we need more vaccinations? 72 doses of 17 different vaccines by the time they're 18? I don't know why American kids need 2 to 3 times more the number of vaccines on the planet. And then since vaccines only last between 4 and 10 years, the antibody effect on them, that means most of you in here are not contributing to herd immunity. You're part of the unwashed, unvaccinated evil ones that are spreading disease. Okay, do you see this? This is crazy because you're genetically sick. You're predisposed to disease. Do we need more surgeries? You're right, you came with a lot of extra parts. you know, your species is just messed up. That gallbladder, let's eliminate that sucker. That's bugging you. So, and I realized that we should get, you know, we just had an infant 4 months old taking antacids. Okay, I know, you know, I know there's no studies on 4 months old on antacids, and we were able to correct his reflux, but I want to explain what we do with this. So now we have a different paradigm. See, there's a few people, one profession in particular, that understands that the body is self-healing and self-regulating. One profession, that's chiropractic. Okay, the other profession that has cultural authority, they know that you're genetically predisposed to disease, and the only thing they can do is give you palliative medical or medicines and surgeries to keep you alive because you're just sick and defective. Now, when we look at allopathic, and don't say allopathetic, that's very rude, okay? The definition is a system of medical practice that aims to combat disease by use of remedies such as drugs and surgery, producing effects different from the incompatible with those produced by the disease being treated. Now you'll see here that it takes a little bit longer to be a chiropractor than to be a medical doctor. Now, I am not a medical doctor. I don't want to be a medical doctor. I have a totally different philosophy of this. I have a doctorate in chiropractic, and it is not a medical degree. I don't want it to be a medical degree. I have a different philosophy. Does that make sense? There's a PhDs, which is a doctor. There's a JDs, or lawyers are also considered doctors. Doctor is a term of medical education. So this is where we're going to cut through a bunch of crap on some of the comments that I've been getting, okay, over the last 20 friggin' years. Okay, I have a doctorate level education. It's not in medicine, thank God, because I have a different belief system, okay? Now, vitalism. Now, this is interesting because there's only one profession that professes that your body is intelligent and designed by God, or there's an innate, inborn intelligence in your body. Now, what vitalism is all organic systems in the universe are conscious, self-developing, self-maintaining, self-healing. And the body has an innate intelligence that guides its development, interactions with its environment. Does that mean that if you're exposed to heat, you sweat? If you're exposed to cold, you shiver? If you're exposed to stress, your body's physiology is going to change? That's what I believe. I really do. Now, this interesting because this is the system based on that paradigm, okay, that your body is sick and defective. They're not going to invest money in health, nutrition, and everything else, because why do that? That'd be a waste. Why change it if you're genetically predisposed to illness? So then we have different professions like the gastroenterologist or the rheumatologist or the endocrinologist, the neurologist, nephrologist. I mean, all of these guys looking at different areas. Now, what's odd is if I was to scare you, I stimulated this part of the automatic nervous system called the sympathetics. That fight or flight. So under a stress state, and this could be physical, chemical, or emotional stress, blood supply just decreased down to your gut. Now, if you're in a chronic sympathetic dominant state or stress state, the blood supply and nerve supply and even motility to the gut would be decreased. So the gastroenterologist would be understandably concerned. He would be saying constipation. So what would he give you? A stool softener? Maybe something to increase motility? If this has been going on long enough, there's going to be gas pain, so he can give you a pain reliever, he can give you an anti-inflammatory, might give you a steroid too. But no one's going to talk to the neurologist who's not going to even check to see if you're in a sympathetic dominant state. Why? Because you're genetically predisposed to have problems. Now, Max Planck, okay, brilliant mathematician, okay, I love his quote. A new scientific truth does not triumph by convincing its opponents and making them see the light, but rather by its opponents eventually dying. And a new generation grows up that is familiar with it. And that's what they say. They say, I mean, medical education is about 14 to 20 years behind the science. And you need an entire generation of doctors who are in that paradigm to die. So now, what does the British Medical Journal say about this biomedical paradigm? And they go in and do the research and they say, well, the biomedical model of illness has dominated healthcare for the past century, cannot fully explain the many forms of illness. the biomedical model, which is what, if you're in that medical world, that you're defective, okay, and genetically predisposed to illness, then all illnesses have a single underlying cause. Disease or pathology is always the single underlying cause. So that means like symptoms and things are a problem. Removal or attenuation of disease will result in a return of health, and this is what the doctors practice. However, evidence exists that all three of these assumptions are wrong. So the medical world is saying that an entire paradigm of your body is defective is wrong. What about the annual physical? Well, Harvard, little school back east, okay, and the New England Journal of Medicine say, for God's sake, don't go to the annual physical. Results in a battery of unnecessary tests, and there's an inverse relationship with this psychotic medical system of money you spend and your health. That means more money spent on the medical system, the disease paradigm, you get sicker. Okay, that doesn't make sense, does it? So they say, do not go for your annual physical unless you have symptoms. This guy, if you get a chance, I mean, water cures, drugs kill. This guy is a brilliant Iranian physician, and he goes in there, he's locked in prison with right when the Shah was deposed. And when you look at this, all these Iranian businessmen, and they had the best medical care, so they had all the health of the American businessman, which is crap, okay? So they're taking blood pressure drugs, cholesterol drugs, type 2 diabetes. They're the sickest species on the planet. So he's locked in this prison, and he's got nothing. You know, he's like the Surgeon General. So they go in and they say, look, you know, doc, what do you do? You know, I'm sick, you know, what do I do? And so he starts thinking, well, all I got is water. So he starts giving him 4 ounces of water every 3 hours for high blood pressure, or 5 ounces of water for this condition, or this. And he starts to see, my God, people are getting better. They're getting better. And so he writes down this book, Water Cures, Drugs Kill. And so the entire medical paradigm of coming up with a disease and treating it with a chemical doesn't work, he found. And he says medical doctors and all of the doctors who hold to the outdated, ignorant paradigm of disease coming from germs, bad luck, or bad genes will be stunned when they realize what is ahead. All of a sudden, they'll feel naked. They'll see many years of learning and memorizing scientific jargons, all the statistical analysis for justifications of treatment protocols, using toxic chemicals and invasive procedures, and the price structure attached to these acquired skills will be declared obsolete. And you thought I was nasty. This is how you kick people in testicles just by reading this. I mean, you got this disease paradigm, okay. Well, in 1998, they said the right drug at the right time and the right doses killed 106,000 people. More recent than that, now it kills 128,000 people. This is killing, not maiming or wounding. This is killing. Professor of osteopathic medicine, 2,460 people a week from the right drug at the right time. So how is this? So if that disease paradigm of where you're defective, you're genetically predisposed, and they give you a toxic chemical and you die, okay, or get sicker, where did this psychotic stuff come from? Let's look at the Journal of Law and Medical Ethics. They say there's an institutional corruption of pharmaceutical, and there's a myth of safe and effective drugs. That the pharmaceutical industry has corrupted the practice of medicine through its influence of what drugs are developed and how they're tested and how medical knowledge is created. See, in 1906, they started to take over medical schools. Why? Because the medical doctors could be the distribution arm for their product. So they're teaching these guys limited knowledge and teaching them this disease paradigm. Thank God for you, because you've got the one chemical that's going to save this defective species. No, you don't need to worry about deer, bear, elk, antelope. Those are all cool. Okay, it's just humans that are messed up. So how does the body actually work? Okay, how does it actually work? Your body is self-healing and self-regulating. Doc, did they teach that in school? No. Wow. Okay, here's the vitalistic approach. The body is, but now you know. He is one of my best friends and good medical doctor. Okay, when you look at this, the body is self-healing and self-regulating, and it regulates itself through the nervous system. The nervous system controls and coordinates every function of the body. Does the nervous system control hormonal function? Yes. Does it control digestion? Yes. And what's interesting, it's in two halves. One part keeps you alive under stress. When the stress is firing off, the rest, digest, and repair is not working, okay, or it's decreased. So it's like after you eat that giant meal, okay, of plant products for Thanksgiving, you don't feel like playing football. Okay, the active aspect of this is to lay around, rest, digest, and repair. So you got that parasympathetic and sympathetic. If your body is functioning correctly, the parasympathetic is active at night so you can regenerate tissue. Your sympathetic is active more during the day. Now this is physical, chemical, or emotional stress is going to activate that autonomic or sympathetic nervous system. So we have this balance of the systems. And it's vital because this is how we adapt to physical, chemical, or emotional stress. It's how we thrive. It's how we've been designed on this planet. So I look at this as the delusion of diagnosis. If you're in a sympathetic dominant state, you're being chased by a tiger. Do you want a fast heart rate or a slow heart rate? Okay, so now let's look at high blood pressure. What's the official cause of high blood pressure? Anybody know? No, can't say stress because I'm sorry, you're defective. Okay, okay, sweet little kid. No, I'm sorry, the official cause. Okay, let's look at the medical cause. It's unknown. Unknown. Okay, we're not going to look at the autonomic because if you view that high blood pressure has an intelligent response by the body, that the body is intelligent, no. You would look at the physical, chemical, and emotional stressors. We're talking about the allopathetic world. Yes, I'm going to use that term. Okay, so you look at this, high blood pressure officially, it's unknown. The vitalistic aspect is, yes, that person's in a fight or flight response. Anybody know the official cause of irritable bowel syndrome? Remember, we're looking at the medical world who are considered, they have cultural authority in your environment. You're taught this because by God, every time a friggin' commercial comes on, and I was watching one last night, that you inject something in your lips, they swell up, so you have really big, pretty lips. Okay, however, it can cause stroke, it can cause damage and everything else. Okay, but ask your doctor if he's right, if this is right for you. So these guys should know everything. So what do you think causes irritable bowel syndrome? What's the official cause? Unknown. Okay, damn. Okay, what about fibromyalgia? Unknown. No, these guys are human experts. They can't be this ignorant. Okay, high cholesterol. Now it's interesting because if you look at high cholesterol, cholesterol has a function. It's the precursor to every stress hormone, particularly cortisol. It's a precursor to every glucocorticosteroid, mineralocorticosteroid, and sex hormone. It's elevated under physical, chemical, emotional stress and tissue repair. So when a chiropractor looks at the elevation of cholesterol, we know the person's under stress. When we look at breast cancer, does anyone know the common cause of breast cancer? Or no, the cause of breast cancer? It is unknown. Unless you look at the natural health websites, you'll find out 95% of all breast cancers can be prevented. And if you can prevent it, that's a pretty good thing. You're not going to see that on the pink ribbon people, okay? Okay, so breast cancer, is that an adaptive response or pathology? Think of this. Why do most breast cancers occur in the upper left quadrant? Knowing that the drainage for the gut, the lymph drainage for the gut goes to the upper left quadrant, could the gut be a contributing factor? Knowing that there's endocrine disruptors and other things that disrupt the immune system, could those be contributing factors? Yeah, you see, Prop 65 warnings in California. There's a number of different things that can cause cancer or contribute to it. But ultimately, it's a toxic or deficient aspect resulting from stress. Does that make sense? So if somebody is diagnosed with breast cancer or breast lumps or tumors or fibroids or any of that, does the doctor go in there and say, man, we got to do a stress test on you. We got to find out your physical, chemical, emotional stress. We got to find out what your diet's like. How many times a day do you have bowel movements? Are you able to sleep through the night? What's your emotional status? Let's get your nervous system checked to see if you're in that fight or flight or stress state. Does that make sense? Attention deficit disorder, okay? Anybody know the official cause? Unknown. Difficult menstrual cycles. Anyone know the official cause? No problem. We can give them, because the body is defective, we can give them a synthetic estrogen, which will raise their level of cancer later on, but at least the menstrual cycles will be regular. So don't worry if you're 12. Okay, multiple sclerosis. Anybody know what causes this? Remember, I know you guys are an educated population. I'm talking to the medical world. Unknown. Okay? It happens to be a degenerative disease. Sometimes it's remitting and relapsing about 90% of the time, so we don't know what causes it. We know sometimes it goes away, and we know sometimes it comes back. Erectile dysfunction. Unknown. We're not going to look at endocrine disruptors in the environment. And low back pain or neck pain. Anybody know what the cause of that is? Officially? Unknown. Okay, this is why. If you can't be a mechanical distortion, the body can't be intelligent giving you symptoms for a reason, because if it was, then the doctor should be doing some investigation to find out what your physical, chemical, emotional stress is, how your body is adapting to this. They're going to look for mechanical distortions or other things instead of giving you an opioid and then blaming the opioids for them prescribing it. Now we have an opioid crisis. No, we don't. We got a stupid crisis. It's a totally different paradigm. Okay, your body isn't stupid. Now let's look at my profession. Can you see why I don't want to be associated with the medical world? Okay, I disagree with them. I mean, think of this. If the more medications you take, the healthier you get. Or do medications cure anything? Anybody? No. Have you ever heard of medications curing anyone? No, they're not even saying it cures anyone. They're saying it's for symptom relief because you're defective and you need it. And we're not going to look at anything. So let's look at vitalism, okay? Now, the body has an innate inborn intelligence. This is what I believe, this is what chiropractic is, okay? And well, actually, there's 86% of the schools, because the medical world is taking over the chiropractic profession. So I'm more of an old school chiropractor. There's 14% of the colleges are teaching this. 86% now, even the college that I went to, is now being converted to the medical paradigm. Okay? Oh yeah. But you know, it's an interesting era we have coming up. Now, dis-ease, and this is how they used to work it, because its lack of ease occurs when the body's natural ability to heal is interrupted. A subluxation, which is a bone slightly misaligned, that's affecting the nervous system, or it's altering that signal up to the brain. It's interrupting the brain's communication to the body, is a mechanical dysfunction of the vertebrae that interferes with the central nervous system's ability to self-regulate, self-organize, adapt, heal, and repair. So all a chiropractor does, see, we don't treat cancer, we don't treat high blood pressure, we don't treat stomach disorders, we don't treat irritable bowel, we don't treat anything. Our whole world is to identify and correct the vertebral subluxations. And then we respect the brilliance of the body, and the body heals itself. Okay? How often? 100 times out of 100. What's the potential? Like, let's say you get that hemicephalic kid, a kid born with half a brain. Let's say they're distorted or damaged. Let's say you get, somebody with 3 rounds of chemotherapy and progressive cancer. Are you going to cure that cancer? No. Or does that person deserve to have their nervous system checked so they can live whatever life they have, whether it's 20 years or 20 days, where the nervous system is clear of interference? Does that make sense? That's vitalism. Okay, vitalism is based on healing only occurs when the body's own healing powers are activated. That's it. The only person that can heal a body is the body itself. I mean, if you get a cut, okay, what you can do, you can wash it out. You can maybe take an effort of approximating the wound, but no doctor can heal that. Only the doctor within. And this is the vitalistic precept. I mean, this is the body has an innate in wisdom. I mean, how many doctors do you have that says, man, your body's smart. I move this and your body generates a life force energy. It's amazing. So now, this is B.J. Palmer. He was one of the developers of modern chiropractic. Now you can look at adjusting of the spine and nervous system to affect an outcome. 2700 BC is the first recorded adjustment in ancient China. Hippocrates said, when confronted with disease, first look to the spine. There have been bone setters in every culture for thousands and thousands of years. Why? Because they felt that there was an innate inborn intelligence in that body. Medicine is the study of disease and what causes man to die. Chiropractic is the study of health and what causes man to live. Now in 1927, and this was a brilliant book by Stevenson's, he wrote 33 principles. I only have the first couple up here, and think of this, we talk in chiropractic about a universal intelligence, that there is a universal mind. And that universal mind is expressed through this innate intelligence in your body. That your body is going to express constipation if you're under stress. It's going to express a fever. Like the cure for the common cold, do you know what it actually is? It's the common cold. It's getting the fever, getting the redness, getting that mucus, getting the coughing, getting the diarrhea, which is going to alkalinize the system. Going through that cellular and humoral response, which is an intelligent response, and your body recovers and you're protected from that virus and any other similar virus or infections in the future. Now, the medical world, your body is defective and stupid, so we're going to give you Tylenol, which increases or damages the liver. It's the deadliest drug in America, and weakens your immune system response, as well as depleting glutathione from your brain. But your fever is better. Okay. Now, what chiropractic is not? I'm not alternative. Hell, it's totally different. Alternative? Okay, good. Go to the guy who thinks your body is defective and take a toxic chemical. That if he does it right, only 128,000 people a year are going to die. Remember, we're not talking about anything else. So I'm not alternative. It's a separate and distinct, unique healing art. Complementary? Definitely not. Antagonistic? Definitely. Why? Because when you work on people, and I've been working on people and doing research for 25 years, you end up liking them. As weird as it sounds, you start to see yourself in them. You end up, bringing love. I mean, really, honest to God. We're not muscle and bone doctors for back pain and neck pain. See, we're not back pain and neck pain doctors because the symptom is there for a reason. Why is it there? That's what we look at. We look at the body's structure. Our entire world is to identify and correct subluxations. That's it. That's all we do. We don't diagnose things. We don't treat anything except that. Now, think of this. A self-perpetuating central motor control problem involving a joint as a vertebral motion segment that is not moving appropriately, resulting in an ongoing maladaptive neuroplastic changes that interfere with the central nervous system's ability to self-regulate, self-organize, adapt, repair, and heal. That is the definition of a subluxation. So now, what's interesting, when we talk about the autonomic nervous system, here's an article a medical journal that states that all chronic illness. Now, 54% of our kids today have a chronic illness that they will never recover from. So we're losing a generation. No, that won't help our ideas get through. We're talking about the generation that's still here. I'm talking about the new one coming up. Remember, losing a generation? It's hard to joke about that. But this one, regardless of the etiology, so it doesn't matter the cause, chronic illness or disease has to do with that autonomic nervous system. Why? Because if you're in a stress state, and this could be physical, chemical, or emotional stress, blood pressure is elevated, tissue repair is declined, your blood supply to the gut is shut down, digestive problems, anxiety, stress, is the system rampant with that? Absolutely. Now here, again, we don't treat Parkinson's. We don't treat multiple sclerosis. Do I have a lot of patients with that? A huge amount. Okay, it's real popular now. Here's a study over 5 years. 5 years. So is this one and done? Is this taking a drug and then saying, okay, you're going to be cured? No, there's no drug that does that. Okay, 5 years, 91% of the MS patients showed improvement, 92% of the Parkinson's disease. Why? Because this MS or Parkinson's, is MS and Parkinson's, is that an adaptive response? Is this the most intelligent? Is that intelligent, that life force interrupted? And if you restore that life force, if you take away the impingements, can the body adapt better? Evidently. Here's a patient that came in with Parkinson's. You're looking at before and after. There's the side view of the neck. A normal neck has a curve. We'll see 100% of people with Parkinson's have massive forehead head carriage, massive. And what are we doing? We're correcting that position, that alteration. I mean, now what we're doing beyond life force, you can talk about the proprioception, the afferentation, how the brain gets that information and uses that information to adapt in a healthier status. Here's a typical guy. And I've used this guy, Dave, a couple of times before, but I want to drive the point home. This was his x-ray when he first came in. Let's look at this. Is his body intelligent, designed by God? Does he have a life force energy? And is he self-regulating and self-healing? Yeah. That's what I would think too. He's my species. Okay? Is he genetically defective? Is he predisposed to disease? Is his species just the sickest species on the planet that's going to die soon? No. So let's see he has joint pain. Okay, what do you want to give him? Tylenol. Okay, good. That's the deadliest drug in America. Anybody know how Tylenol works?
Very bad drug.
Yeah, but anybody know how it works? The clinical pharmacology? No, nobody does. If you look at Tylenol, the clinical pharmacology on it, nobody knows. It's unknown. So it's unknown, but we do know it depletes glutathione, so his brain isn't going to be damaged, and it depletes proteoglycan production, so the building block of cartilage won't be working right. So it's going to destroy your joints, but make you comfortable. Asthma, inhaled steroids, yes, that's going to shrink the swelling of the bronchus and predispose you to certain cancers. And doesn't fix the problem, by the way, because asthma is a problem of the smooth muscle control. Indigestion, Prevacid, the little purple pill, 24 hours worth of relief. However, it increases esophageal cancer and heart damage and mineral absorption, and actually damages the stomach as well. High blood pressure, metformin. Okay, 95% of all type 2 diabetics or of all diabetics are type 2, and this is where you would get metformin. Now, it lowers blood glucose, however, insulin remains high, and it increases risk of heart failure. Constipation, no kidding. Does he take plenty of water, or do you think he might be dehydrated? Okay, high cholesterol, yeah, his body's under stress. But why not give him Lipitor, which increases heart failure and hardening of the arteries? Neck spasms, oh, muscle relaxant. Do you know those don't work on the muscles? They attack the base of the brain. They're a central nervous system toxin. Sleep problems, Ambien. Most sleep drugs give you an average of 12 minutes more sleep a night and cause drowsiness and sleep effective. And so you cannot heal at nighttime if you're taking those. Sexual dysfunction, don't worry. With all this stuff, let's let the guy have some fun. Of course, this can cause other damage as well. Okay, depression and Prozac, don't worry about the suicidal thoughts and suicide warning on the box of Prozac. And does anyone know how it works? No, neither do they. Okay, and aspirin, the 4th deadliest drug in America to thin blood, why not get the water? Okay, or bam, that's him 90 days later. So when you're taking multiple medications, what we tell all the patients, don't take 2 together. This way you're not messing with the doctor's orders, separate them. If you can, separate them by an hour, that'd be cool, and drink a full glass of water in between so you lessen the toxic effects. And that's just common sense. This is a gal, she came in with a tumor in a 3-month-old fetus, a tumor the size of a grapefruit in a 3-month-old fetus. Her sister brought her in, and her sister's family had some really good results here. And she goes, go to a chiropractor? I got a tumor in a 3-month-old fetus. They gave her 2 options. We take the tumor and the kid will be born deformed, or we kill the kid and take the tumor and then you'll be okay. She wanted option 3. So she comes in here. I cannot x-ray her because she's pregnant. I didn't want to harm the kid. But I did have a diagnostic ultrasound machine. So we checked it and I said, look, if the body's going to lay down a tumor, that's an intelligent response. Let's adjust the area, such as the pharmacy of the body, which are the adrenals. Let's get your neck worked. Let's look for any impingement in that nervous system, clear that innate intelligence, and the body's immune system may be able to take care of this. Well, after 2 months, the tumor had shrunk from a grapefruit down to a lemon. Okay, after 1 more month, so now the kid's 6 months, 7 months, it was down to a little bit like a line, and the kid's growing good, and I didn't want to keep bombarding the kid with high frequency ultrasound waves. And so when the kid was born, no more tumor. Yeah, and the kid's healthy. That's actually the kid. He's actually a cool kid, by the way. He's like 7 or 8 now. Multiple sclerosis. We don't treat multiple sclerosis. This is a before and after. This is a guy who couldn't tie his own shoes. And he comes in one day after about 3 months and he says, look, and where I'm looking at his shoes, and he says, look, I'm looking at his shoes, I'm going, okay, what? He said, this is the first time I tied my shoes in 2 years. You know, I mean, it's just like, but what are we doing? We're letting the innate intelligence that's in the body heal the body. So when you know that the autonomic nervous system, okay, what does this guy have? 5 medications. Okay, obviously that's crazy. High blood pressure, HTN. High blood pressure is in a sympathetic dominant state or parasympathetic dominant state. He is in a sympathetic dominant state to have high blood pressure. Now, you also have this balance of the thyroid and adrenals. Under stress, the adrenals are going to be firing, the thyroid's going to be low. So he's got high blood pressure, indigestion. Does that mean healthy blood supply and nerve supply to the gut, or decreased? Decreased. And then low functioning thyroid. No kidding. So those are the drugs he's given. Why? Because the medical world is he's defective. And he's predisposed to it. It can't be any other possibility. That's his x-ray. Okay? He was in a stress state. You release the subluxation, he gets better. Not because we're treating any of this. We understand that each body is self-healing and self-regulating. This is a journal article that talks about high blood pressure can be corrected by adjusting the top bone in the neck. Amazing. Journal of Hypertension. Here's 82 years old, bladder control problems and low back pain. Again, before and after, we're not treating those symptoms. Okay, we're correcting that lack of communication, that interruption of communication from the brain to the tissue cell. This gal, it's hard to tell unless you've looked at 1,000 x-rays. That's a swollen, inflamed sacroiliac joint. So that's going to put her in a stress state. Are we going to fix the sexual dysfunction or the bladder problems or any of that? No. The body is presenting this. It's screaming. It's saying, my God, we got all of these systems that are failing. Please restore that brain's communication to the body. Does that make sense? Absolutely. There's nothing else it does. Here's a gal that was up for knee replacements. If you have any idea what good knees look like, these are what good knees look like. But her patella, that little shadow thing, is off to the side. So she did have a patellar tracking problem, which is from the low back. No one thought to look at the low back until we looked up there, because I think that knee pain is an intelligent response by the body to tell you something is wrong. I know. Blame my mom. She gave me nothing but common sense. You try and be raised in this world with common sense. Okay, got better. This gal, reverse curve in the neck, grade 3 arthritis. Does that mean that she's been under stress? Absolutely. She developed breast cancer. Okay, and so they did the same thing. Surgery, chemo, and radiation. No one's looking at the stress state. Okay, you're seeing the discs start to regenerate. Okay, we're not going to fix the cancer, but by God, does she need that communication clear? Cardiac arrhythmias, the top in the thoracic areas where the nerves that supply the heart. You can see the one on the left, that's him standing up straight. Do you think he had some type of trauma? Do you think he was in a stress state? Absolutely. And we didn't correct that either. It's correct. It's appreciating that symptoms are there for a reason. You don't drug and cover up the symptoms. That has a poor outcome. Post-surgery, you would think 7 surgeries, she'd be just about ready to dance, right? No. Okay, before and after again. See, this is the thing. They call it ADIO, above, down, inside out. And this is all hardcore chiropractic philosophy. But can you see it's more factual than anything else that's out there? It doesn't have cultural authority yet. But when, like Dr. Bergman D.C said, when they're going to feel naked when they find out that their scientific jargon is just for naught. It's just delusional to think that the human being, which is brilliant, It's an expression of life. It's got a life energy. It's more energy than matter. I mean, the more research that I do, the body is not just this corporeal form. There's a life force and energy that flows through this. And it's literally from the universal intelligence through the brain, down the spinal cord, out, inside out. And that's why they call it ADIO, above, down, inside out. I mean, this is how the body regulates. It's the life force energy. There's no profession other than chiropractic that espouses that. I mean, this is the truth. It really is. Can you see that when we put this up, every talk, whether it's cancer, whether it's blood pressure, whether it's digestive disorders, whether it's attention deficit disorder, whether it's vaccine damage, whether it's depression, anxiety, suicide, goal setting, how to take care of your spouse, anything. We put the same 5 things up. Why? Because this is how your body works. Your nervous system controls everything. You got to get it checked. The only profession that appreciates that you're normal and human, that's it. Exercise, you got to move it. Proper nutrition, you're not going to put crap in it because you get a crap body. Sufficient rest and prayer and meditation. Why are all of these equal? Why is prayer and meditation up there? Because you're more energy. Do you know what a subluxation actually means? Sub means less than. Lux means light. A subluxation is limiting that light, that life force inside of you. I know, you can say it because I know I'm feeling it too. Isn't it cool? I mean, you guys are beings of light and energy. This is neat. Okay, go to Extreme Health Academy. They've got a ton of stuff there. I mean, we do. Definitely, you're going to get some great education. Multiple doctors there. Go to our drjohnbergman.com site. When you go there, we got a disease database, tons of articles, but you're going to find out what the disease is, and we won't put unknown, because we know it's an adaptive physiologic response. Does that make sense? I had to vent. Okay, what time is it? 41? Okay, we can take a couple of questions. Yes, sir.
You always show slides and you continue to see high blood pressure, depression, all these things. Kind of more than less, they always go together. So could you say that along with the person's spine possibly being messed up, also their perception in life can be causing issues?
Buddy, exactly. Okay, because if you can think yourself sick and think yourself well. I mean, one of the challenges that we got, does everybody think our economy is going great and the world is just fantastic and our food supply is spectacular and we've got tons of food and the economy is great? Oh my God, you know, don't worry that OPEC is no longer trading US oil for US dollars and there's no gold currency to back it. The world is wonderful. Anybody believe that? No, but here's the challenge. If you're in the mindset that the world is going to hell in a handbasket, what's your physiology going to be like? Okay, there are going to be a lot of changes coming up. Absolutely. Okay, you prepare for it, but then you still live. Okay, the mindset is huge.
One more thing, have you ever done a slide or plan on doing one on the
pineal gland? I haven't yet, but I've done on the hypothalamus, hippocampus, and amygdala. Okay, I'll get to the pineal. He's small. I hardly ever pay attention to him. Michael, were you able to hear that one?
Yeah.
Okay. Yes, ma'am.
My uncle is 70. He has had 20 years ago a quadruple bypass, and then 5 years later a defibrillator. And now he's in the hospital because the thing is not working right. He is on 10 medications, and they just gave him 3 more. So I'm not very, I'm not very, how to say?
Confident in his outcome.
No, I'm not very liked for saying take the medication
Oh,
away.
God, yes. Oh, yeah. Yep.
What I want to know is, would it theoretically be, has it been done, that you take those bypasses out and the defibrillator out and somebody would get better?
Oh.
Or would that kill the patient? Because they say without the medication anyway, he would be dead.
Here's one of the challenges. They started to develop bypass surgeries, and we did a whole heart series on this back in the 60s. And they thought, okay, let's put some dye in there, look at it through a radiograph, and then we'll see if there's a clogged artery. If it is, piece of cake, just makes common sense. Take a vein out of the leg, go around that clog, brand new blood supply, bam, bam, done, done, okay? Except what they found after doing this for multiple years, they found out that not only do 80% of the bypasses clog within 5 years, but the person had a poorer outcome because you could treat clogged arteries with certain medications. Okay, not fix it, okay, because if you want to fix it, you have to get on soluble fibers. They're going to clean the arteries. You got to stop taking the toxic products that damages the arteries and stop taking the drugs that damage the arteries that caused it in the first place. So the bypass surgeries don't work in the first place. They don't make you live longer and healthier. So then they developed angioplasties, okay, which is a little balloon you put in there and blow it up right around the clog, and so you expand the artery. Now, evidently, whoever developed this forgot that the arteries have a muscular layer, so they constrict and contract, or constrict and dilate. So that didn't work. So then they came up with screens. So this is going to be a stent. Okay, so let's put a wire cage in there and put it in there, and that expands it. Well, that didn't work either because the blood started to clot because you're putting a wire cage in a living tissue. And that didn't work real well, so then they came up with medicated stents, so blood can't stick to it. However, this caused a massive rise in strokes. So and the defibrillator actually has this like trident-like spear that goes up, down, through right through the tricuspid, jammed into the floor of the right ventricle, so you can't really pull that one out. I've never heard. They're doing stent retrievals now, but that wire is going to be closing around that valve, or the valve's going to be closing around the wire for forever. The only thing you can do is to educate him, get him on the soluble fibers, tell him to try and separate the medications if he can, and get oxygen to him. But he's going to be dehydrated like you can't believe. His legs are going to be swollen. He's going to be taking a couple of different medications. When you see our blood pressure talks, for every one blood pressure medication you're taking, your risk of stroke increases around 30%. On 3 blood pressure medications, you're at a 247% increase in stroke, so it's exponential. So the drugs that they give you to prevent stroke, the high blood pressure ones, actually cause it. Education. I need to do, does he speak English or just German? Good, turn him on to our videos. But it's not going to win you friends or... But that's the tough part. That's why I did this, because I'm not making a lot of friends because I'm going against belief systems. But if you love people, what are you going to do? I'll take a hit for saving a couple of people. That's worth it. Yes, sir.
Scar tissue. What is it? Why is it? Can you get rid of it? Either on the outside or the inside where you can't see it.
Oh, God, this is so cool. Okay, think of how smart the body is, okay? If you break a bone, the body thinks that you're going to maybe injure that again. So any broken bone is stronger than the surrounding structures. Okay? If you tear skin, and I mean deep, okay, the body thinks you might be in a situation where you may injure it again, so it makes it thicker. And instead of putting these beautiful inline flexible fibers, it wants this baby tough. So it starts doing cross fibers, and that's called scar tissue. It makes it less flexible, but a hell of a lot tougher. Okay? I mean, pretty cool. Okay, you can get rid of it by, or decrease it by working the matrix. Like I had the bitch in a scar that went from here down to here. You can just barely see it now, but God, it looked cool. I mean, Pirate Days in Catalina, I was so looking forward to it, because I didn't have to do makeup. But, if you scrub it with a white cloth, a cotton cloth, and use heat, you're breaking up the matrix, and you're going to start to literally have it reform. Okay? Because, skin is always produced. Every 28 days, blood's brand new every 120 days. Pretty much every cell in your body is changed every 7 years. So your body is always changing it. So why does scar tissue there? Because it's laying it down in the same matrix. And this is why you'll see bone spurs go away, you'll see discs regenerate, you'll see a lot of stuff because the body's very dynamic, not what you're going to hear on the news. So now there's scar tissue on organs as well. A few years ago, I was run over by a car and had my legs broken, my sternum fractured, my skull fractured, which gave me a cool scar. Okay, but I also bruised my liver and bruised my heart. Okay, so now those organs have that damage on it. No, Sarah, you fixed my heart. Don't worry. I'm talking about a physical bruise. God. Okay, so you get this, okay, and the body is going to start to reform it. Okay, so you can increase it by putting moist heat on it. The organ tissues, they're going to start to go away if the damage isn't too severe. But the body will adapt. You know, we've had a lot of patients with wounds where they've had metal bullets, glass fragments, and the body will either wall it out or slowly work the glass out. Has anyone had you know, because we got a bunch of patients that they're picking glass out of where they had an explosion on it up to 10 years afterwards. So the body it heals, but it heals, you know, in its own time. Yes, ma'am.
I think I've heard you talk about this, but I don't remember. If you have like rough heels, is that related somehow to your spinal structure?
If
Like
you
the
have,
skin?
well, if you have rough heels, they could be either you're walking on it. If it's on the right leg, it could be nutrient deficiencies or blood toxicity, because typically things like gout and those blood diseases or blood disorders or blood toxicity will show up on the right side first, because that's the furthest point away from your heart, and it's the least blood pressure on the right side. The left leg generally has a little higher blood pressure. So it could be a nutrient deficiency, it could be the gait at how you walk, okay, or it could be compromised nerve supply to that area. Okay, yes ma'am. Question.
My husband complains of brain fog a lot. What can I do to help him?
Okay, I'll repeat that because your voice is kind of quiet. Michael's got the one thing. My husband complains of brain fog. No, not my husband. Okay. No, dear, you're safe. Okay. Brain fog, think of this. Okay, if you're in a sympathetic dominant state, your complex thought is going to be suppressed. Okay, so he's just trying to survive, and that's what we'll see. Brain fog is super common with all those delusion of diagnosis things that I put up. It's that person is under stress. And so when someone comes in with just brain fog, we'll say, take off your shoes, let me see your feet. So if his big toe's leaning towards the other one, he may have some type of pelvic issue. Then I'm going to ask him, do you get up at night to pee at all? And they'll say, no, just a couple of times. Okay, good, their sleep's interrupted. So he's in a stress state. Now that could be a mechanical stressor or a physical stress. It could be a chemical stress, you know, based on his age, if he served in the military or vaccines or toxic food. So this is what he needs to do. Because that brain fog is the body is in a stress state, no complex thoughts or long-term memory. He's just surviving. So you need to get his nervous system checked. And then once we identify those problems, go over his exercise, nutrition, deep sleep, and prayer and meditation. It seems kind of cool, doesn't it? Next week, hopefully the internet will be working. But thank you very much.